Here we are now, part 3 of Special Senses, page 558, and we're taking a look here at how the sensory devices here, rods and cones, are embedded into the choroid layer. And we have a special situation here where we're emphasizing these discs. What are these discs? We know that these are cells, and we know that discs like this are Golgi apparatus, actually. And so that's actually what's going on here, is we have an ever-evolving Golgi apparatus that is going to ultimately have its most distal units, saccules, phagocytized back into the choroid layer here. And so this is ever-growing and ever-producing new units. We're familiar with retinal, which works in this area, and lutein, which works in the cones. Maybe you want to have some lutein in your diet, along with some vitamin A or carotene in your diet. Okay, so, and then we have, we know more about this particular one. We're just now learning about the cones. We've been knowing more about rods for a long time, and we know that we have this particular protein that's transmembrane, and this is the opsin protein. And then if we add a little bit of, just mix in lightly, a little bit of vitamin A or retinal, that it will actually fit into a space right there. It's a fat-soluble vitamin which fits into the fatty acid tail region here of this protein, where it's fitting right into that part of the membrane there of the saccules. And this is the visual pigment then, which is complete at this moment. Okay, and so that would be considered rhodopsin. Here's a little workup of rhodopsin, in which when we're in the dark, it takes a little time to develop this complete molecule, the rhodopsin. So we're going to have to spend a little time here. They're not mentioning here, but it's probably 15 or 20 minutes of time that needs to be spent to get to the full-on rebuilding of rhodopsin. And you have good night vision. If you walk into a dark theater, the first thing you see inside of a dark theater, if you're coming from daylight for a matinee, you're actually seeing just black velvet when you first step in to the viewing room, and you have to stop and wait just a few minutes to build up some rhodopsin so you can see where there might be an available seat. As you exit the theater into the bright sunlight, we get a bleaching, it's called. The opsin loses its retinal, which actually changes shape slightly, and that's the reason for it dropping off, is that it no longer fits into the active site. Okay, and so it's actually a rather quick procedure, just a matter of minutes. Maybe in 4 or 5 minutes you're completely back into using your cones and not so much the rods. Okay, and then that brings us over to this little dark current episode here, and we have a moment of science noir, dark current. And a dark current is a feature of the rods. Remember, the rods are not part of the central vision, they're part of the peripheral vision. And so I've drawn here on the back of the eye, so to speak, we'll say that this is the retina. And here I have a circle with maybe, let's say, 200 rods all gathered together and using only one optic neuron. And all of the rods out here in the outer part of the circle are hooked up to that particular neuron, and they actually cause hyperpolarity. This on-center region here has a group of receptors which are acting to open sodium channels, and therefore they're creating EPSPs, excitatory postsynaptic potentials, and we actually get depolarization when we're in here. Okay, and we have these next to each other. Here's an off-center, here's the on-center. Out here on the periphery, that's on. The next one is an on-center with an off-periphery. Okay, and in the rods, we have a current passing all the time. It's called the dark current. It's above threshold, which means we have depolarized to this dark current. We're actually functioning here. There's current. Okay, 40 millivolts. We're going along, and I'm presenting here this bird that I've just drawn. quickly, and question mark bird, and it's going to take a flight across the landscape of your retina. It's going to project an image, moving image, and as it comes over here, it's going to turn off the signal. Okay, and you'll get hyperpolarization, and then it'll turn on, it'll go on. Up here you get depolarization, then hyperpolarization, then depolarization, then hyperpolarization, then depolarization, hyperpolarization, then depolarization, hyperpolarization, and then you're finished, and you're back to dark current. Okay, and what is the advantage then of having this arrangement in your peripheral vision? Is that you use your peripheral vision to look at the large landscape, shall we say, slightly out of focus, if you would. If you're going to be throwing a ball to somebody who's in movement, if you're a football player, if you're a soccer player, and you want to kick the ball, pass it to your partner, and you want to sort of figure out where they might be, you're actually looking at their movement and you're gauging where they might be in a few seconds, and you're kicking the ball, you're passing it to that location, hoping that your partner will continue on their trajectory. You're also, if you're in a race, you're looking at all the other members of the race and seeing their relative speed and be able to negotiate or match their speed. Okay, so that's the benefit then of peripheral vision that cannot see actual color or cannot see detail, but can definitely see relative changes in speed of things. And you can even be, how shall I say, a little bit surprised or startled. So there's a startle reflex that uses part of the visual pathway called the superior colliculus. And so the startle reflex is most certainly activated by the peripheral vision and the rods. Okay, and here is the pathway now. So coming from each eye, notice that the pathway is divided so that the medial aspect of the retina is going to cross over in something called the optic chiasma. And the lateral portion of the retina up to the disc here is going to stay same side or ipsilateral. So this is going to, now if we have an object, where's our object over here? Let's have an object in the periphery. Here's an object now. Okay. And the object is in the far edge of the periphery. And it can be seen by this eye over here. And it's going to go to the lateral side. And it's going to stay same side. And then over here, it's going to go to the medial aspect of the eye. And it's going to cross over. So do you see that if you have an object in the far edge of your peripheral, on the far edge of your vision, now they're calling this left, I don't know why, but it's going to the right eye and it's going to go to the right brain. So whatever we do here, it's going to cross over. Do you see that? Over here, if we have an object, it's going to come this way and it's going to go to the lateral side of this eye, stay the same side. It's going to go to the medial side of this eye, and it's going to cross over. Okay, so anything that's in your left peripheral vision will cross to your right. Anything that's in your right peripheral vision will cross to your left. And then we have these interesting little midbrain structures right here. And this one is referred to as the superior colliculus, and it is responsible for visual reflexes. Okay, and so that means if you have a startle reflex or you're gauging the speed of fellow players on a field, then you're using your superior colliculus. Okay, and that concludes our part 2.